Hi, and welcome back to the Tea Morning Show, where we will talk about some health issues. Because since October is Breast Cancer Awareness Month, we want to talk about breast cancer. Now, according to the official website of the Indonesian Health Ministry, the most prevalent form of cancer among women is breast cancer, with 65,858 cases. And one of the causes for cancer in Indonesia is unhealthy lifestyle.
That is right. And when talking about cancer, I am sure that chemotherapy is the thing and treatment that comes to mind. But however, there is another treatment method, and it is called radiotherapy, which is often mistaken as the same with chemotherapy. However, those two are actually different from another.
Yes, now to talk more about radiotherapy, let's welcome Mayapada Hospital Tangerang radiation oncologist, Dr. Steven Octavianus.
Yes. Good morning, doctor.
Good morning.
Thank you.
All right. All right, now let's jump into our first question. What's the difference between radiotherapy and chemotherapy?
Yes, there is three modality main treatment for cancer: surgery, chemotherapy, and radiation therapy. Chemotherapy is basically you putting some drugs to your body, with either with the IV line or it taken orally. But radiation therapy is more targeted only the local, with the breast. For patient with having a breast conserving surgery, we treat the breast and the lymph node regional, and then but after mastectomy, it's likely more like amputation, that the breast is coming off after surgery. So we just take care the chest wall, the base of from the breast, and then the lymph node regional. Because cancer has mainly three characteristics. They invest to the nearly structures. It can be another organ or another muscles, and then lymph node, and then the blood, and we call it metastasized in other organ. So
okay. Now, if a patient is already wanna try the radiotherapy, does she or he needs to go to surgery first and then radiotherapy, or is it like
in breast cancer we take the radiation therapy after the surgery, and then after chemo. But sometimes there is breast cancer is many type, depending on the hormonal receptors and then another genetic genetic impairment. So we basically stratify the risk. Whether the risk is very high, the chemo should come first, and then the radiation therapy to lowering down the risk of the recurrence.
So actually, it is a step 3.
Yeah.
You got surgery, you got chemo, and then
radiotherapy.
But in Indonesia, the cancer is come from another bulky tumor, so the surgeon cannot take care another that breast, so surgery is not an option sometimes. Then we can do in the front to minimize the size of the tumor. To surgeon can do take off the breast.
So the next question would be, how effective is actually radiotherapy compared to chemotherapy, or is it helping one another?
It's helping one another. Okay. For breast cancer, adding radiation therapy treatment is lowering risk of 20% of recurrence. So it means a lot for patient. So if patient do well from the beginning, the tumor size is not large, it's small, and then after completion surgery, the risk stratify is low, and then they get chemo, and then they go to radiation therapy. The risk is below 10% to get the recurrence. But if we don't add radiation therapy, the risk is 20% higher.
Oh, okay. Okay. Now, doctor, we also want to know, during chemotherapy, there are a lot of side effects that the patient would have to go through. Now, what are the side effects of radiotherapy?
The side effect of radiotherapy is only local and that area of the radiation therapy. So it comes with skin rash, and then the itching, and then some people get dizziness, and then they feel like
a feverish?
let
fever?
fatigue.
Oh,
Then some people with the lowering the leukocyte, then lowering the hemoglobin. That's sometimes of type of the
Side effects.
The
side effects from the radiation therapy. But actually, people can do better to coping the side effect from radiation therapy.
Okay,
Oh,
okay. Better than
chemo.
chemotherapy.
Okay, so doctor, if there are many stages of cancer, right?
Yes.
If the cancer is still in the early stage, is chemotherapy still the first option, or you can go skip it and jump into radiotherapy?
We should see the guideline. So we follow the guideline. So we follow the rules of the treatment cancer, because in cancer treatment,
It's not the same thing for every cases, right?
I see the analogy 1 + 1 is not 2 in the cancer treatment. So if we follow the guideline, even we cannot expect the result is as a textbook. So in cancer, it's very different. So we tailoring the treatment like personal, but depending on the risk of their status from the surgery and then the cancer type. So we manage it very carefully. If patient has low risk, they can skip radiation therapy with hormonal therapy, but with the notes that have hormonal receptor positive. So if they not have a hormonal positive, chemo should come first, and then get the adjuvant radiation therapy after surgery.
Okay, okay. Now, can you walk us through the procedure for performing this radiotherapy?
Yes. The first, the patient get the consultation. We made stratify the risk, how much they want, the risk of the recurrence. So after that, patient get the CT simulator. We put it like a suit, or we tell a mask for their body, and then the chest wall. And then our doctors take where area is the high risk of recurrence, like chest wall, and then the regional lymph node. And then patient just go to treatment after we plan. Sometimes patient get 25 from 16 until 33 radiation fraction. So patient should come every day. Patient should come from Monday to Friday, and then take a break for Saturday and Sunday, and then go back to another treatment for every day. But the treatment is almost take 5 to 10 minutes session. So it's very short, because nowadays is technology for radiation therapy is very good, lowering the side effect, and then only targeting the cancer
Itself, not the
itself.
whole
Not the whole body.
I'm so sorry.
So that's right. You are okay.
It's okay.
But anyways, doctor, I know this is Breast Cancer Awareness Month. It's October. But can radiotherapy be used for other diseases other than cancer?
Yes, some research do prove that radiation therapy can use for another treatment disease, not only cancer. Like some people with keloid, so after the removal of the keloid, we take the radiation therapy, and then the risk of keloid giving back is very low. And then some brain tumors, some malformation from the brain artery or vein. So it can be done with the radiation therapy. It can be treated with radiation therapy.
I see, but would it affected the tissue around that that area? The normal tissue
Yes.
would get affected also.
Yes, but we just targeted 1 or 2 centimeters. It measure with by millimeters. We take care. We make a margin 5 or 7 millimeters from the bed of the tumor or the bed of the keloid or something like that. So it's very little.
Okay, okay.
Technology.
Yeah.
Technology.
Now, we want to go back to at this time, because this is October Breast Cancer Awareness Month. What causes breast cancer in the first place, doctor?
Lifestyle. Genetic only take 5 to 10% of cancers.
Okay.
And then 95% is lifestyle.
Okay.
It can be the diet, it can be the low activity, sedentary lifestyles, and then alcohol beverage, smoking.
Okay.
That's the main risk factor of cancer, many types, not only breast cancer.
How about sleep? You know,
The stress.
yeah.
Did you mean stress? Yeah, stress is a high, make a great risk for cancer because it engage your lowering your system immune and then make your body get high of inflammation, but you don't realize the low grade inflammation in your body because you're stressed. It accumulated day by day, and then after very high, your body cannot compensate, and then your body getting illness, and then your system immune is low, cannot fight the antigen or bad cells, and then you're getting more higher risk for cancer. Not always getting cancer, but higher risk for getting cancer.
High risk for getting. So yeah, a more healthy lifestyle is actually a medicine.
Yes.
To a lot of health problems, right?
Now, I also want to know, because I'm a woman, at what stage we need to get ourselves checked? You know, how long would it, for us to know that if we have it in us?
Basically, the guideline is show that women before 40 you can do
Mammography.
USG, the ultrasound for breast, and after 40 you can do mammograph. So if you get your first degree relationship has a history of breast cancer, you may take the early detection cancer earlier. Maybe in your 30 or 35, you can do the ultrasound for your breast, and then after 40, you routinely 1 or 2 years to get the mammogram. And then the first of all, you should take care of your, in Indonesia called sadari, self-checks of your breast after several days of done menstrual. So after taking a bath or changing clothes, you just seek your breast or something to take care. Is there any something different than usual?
Like lumps and all.
Like on the breast.
Wow. So again, this is October, and this is Breast Cancer Awareness Month. Before we wrap this talk show, Doctor, is there anything that you want to share to the audience in Breast Cancer Awareness Month?
Don't get scary when there's something bad in your breast. Go do checks, because sometimes it's not just cancer. It can be another breast tumors that not cancer. So if you too scared to come to the clinics, to the doctor, to see the doctor, to see help, it be dangerous. So early detection save lives.
So go to your doctors. And is this right that breast cancer, that men can also have breast cancer?
Yes, but very low.
Very low.
Very low, below 1%.
Below 1%. Better safe than sorry.
Yeah, so get yourself checked, and because this is a Breast Cancer Awareness Month, we need to check ourselves also daily. So yeah, women, everyone, take good care of yourself. Thank you so much, Doctor.
Thank you very much, Doctor, for spreading this information. It is quite the technology now, right? We have more in the medical world, right? So thank you very much again, Doc.
Thank you for having us today.
Yes, that's it for our first talk show of the day. We'll have more interesting stories from around the world after the break, so stay here with us on the C Morning Show, only on C Today.